Hello everyone, welcome back to our YouTube channel Dental Mnemonics, the channel where learning is smart and fun. We received a notification on our Facebook page from a student requesting to make the topic immunoglobulins and hypersensitivity reactions easier. It's a little longer video compared to the rest, but we have tried our best to summarize it in a very easy way. So let's get to it. We know there are immunoglobulins like IgG, IgM and IgA, the most commonly encountered immunoglobulins. But when it comes to the order of the serum concentration, it can be confusing. Not anymore, because we have this mnemonic GAMED as in someone playing a game like game. Also remember, G is for the greatest and E in least is for IgE. So IgG is the highest in serum, followed by IgA, then IgM, and both IgE and IgD are kind of similar. They are the least, but it is said that IgE is the least, and you can memorize it because in least there is the E, so that stands for least. So this can be a very helpful trick to memorize this. Now let's discuss important points for each of them, starting with IgM. We can relate M with men. So they have their primary function compared to the other IgG, which is IgG as in girls. So IgM is the first immunoglobulin to be produced. And notice when I write M, there are 5 points used. I can show you. See here. You can see the 1 point, 2, 3, 4 and 5. It suggests that IgM is a pentamer. Now coming to the other IgG, we discussed the IgM where M was a boy or man. Now comes IgG where G stands for girl. So since men are primary producers, girls are secondarily produced. So IgG is produced secondarily and is very useful during chronic inflammation, whereas IgM is primarily produced and it is very essential during acute infection. So as stated before, G stands for greatest. So IgG is the immunoglobulin which is secreted highest in serum concentration. Another G stands for gestational because IgG is the only immunoglobulin which crosses the placenta or the blood-brain barrier. And also, since it is gestational, we can relate it to hemolytic disease of the newborn or also erythroblastosis fetalis. The other G here stands for grabbing with phagocytosis, or it's meaning that it is involved in phagocytosis or also opsonization. Opsonization is a process by which pathogens are coated with opsonins such as antibodies like IgG or complement proteins like C3b to enhance their recognition and phagocytosis by immune cells like macrophages and neutrophils. Another important fact, compared to boys and girls, we usually say girls are hot, right? So here hot stands for warm. So girls or IgG, it causes warm hemolytic anemia, and the boys, that is IgM, it causes cold hemolytic anemia. I hope IgG and IgM is clear. I have a table to summarize the IgM and IgG. For the response timing, since men are primarily produced, so for acute infection IgM comes into play and they are the first antibody produced in primary immune response, whereas IgG, girls, they come secondarily, so they dominate in secondary immune response. And talking about the mnemonic, I said that compared to men and girls, girls are comparatively hot. We usually say hot girls, right? So it suggests that girls are hot, so warm autoimmune hemolytic anemia is for IgG and cold autoimmune hemolytic anemia is for IgM. And when it comes to fixation complement, we usually need the help of both boys and girls, right? So compared to all IgG, IgA, IgM, IgE and IgD, the men and the girls, that is IgM and IgG, are the one which plays a vital role in fixing the complement. And among them, the strong activator is men because they are primarily produced. So IgM is a strong activator for classical pathway to fix the complement, And IgG, it also helps in fixation of the complement, but it is less strongly in compared to IgM. And we already talked about opsonization because the Z was for grabbing the phagocytes, so the direct role is played by IgG because it binds to the FCY receptor on phagocytes, and the indirect role is also played by IgM via the complement like C3b deposition. And the other Z was for gestational, or IgG is the only immunoglobulin which can cross the blood-brain barrier or the placenta, whereas IgM, it does not cross the placenta. And talking about structure, I showed how M is made by using 5 points, so it's a pentamer, while IgG is a monomer. And other Z, it stood for greatest concentration in serum, so IgG has the highest concentration in serum, whereas IgM is lower compared to IgG. And special note, like I already stated, IgM is primarily produced, so we use it for early defense, whereas IgG is secondarily produced, so it plays a role in chronic infection or long lasting protection and memory. So I hope this makes it clear for IgM and IgG. Now coming to IgE, which is the list in order of serum concentration. So remember the 4E first used in IgE. First comes eosinophil, then degranulation, and like allergy you can write as allergy, parasite, and histamine. So you can also remember it in this way. First the E is used in first letter, the E in degranulation is used in second letter, and all of the rest of the E's are used in last letter in allergy, parasite, and histamine. So now let's break it down. Like eosinophil, IgE, it binds to eosinophils. Degranulation, it triggers the mast cell and basophilic degranulation upon allergen exposure. And for allergy, IgE mediates type 1 hypersensitivity reactions. And for parasite, elevated IgE is a hallmark of immune response to parasite infection, especially helminths. And histamine, IgE cross-linking leads to histamine release, causing vasodilation and bronchoconstriction. And also a fun fact, like in type 1 hypersensitivity reaction, we can memorize it as 4A, in which the common ones are allergy, atopy, asthma, anaphylaxis, which all mediates type 1 hypersensitivity reaction. And I have a mnemonic called ABCD or ACID, which I will discuss after we complete this all slides of immunoglobulin. So now coming to IgA, so like we remembered IgM as men, IgG as girls, so now remember IgA as areola of breast. So why areola? Because there are two areola in breast, right? So we relate everything with 2 for IgA. So since 2 is a dimer, so IgA is also a dimer. Like for IgM, we made 5 points for making the M, so it was a pentamer, whereas IgA is a dimer, and rest all of the immunoglobulins are monomer. Also, since we are relating everything with 2, so there are 2 areolas or there are 2 breasts, and also we see tears running from 2 eyes, both of the eyes, and also mainly saliva is produced from the mesosalivary gland, which is 2 in number, that is the parotid gland. So this helps us remember that IgA, especially the secretory IgA, is dominant antibody in saliva, breast milk, tears, and also mucosal surface, providing frontline immune defense. So I hope that makes clear about IgA. Now finally coming to IgD, here D stands for differentiation, and this is the immunoglobulin which is least understood. Also, I have this analogy which can be helpful. It's kind of a vulgar, but I hope this will be helpful. Like men have D and balls. So men as in IgM, D as in IgD, and balls as in B cells. So the summary is that IgD walks alongside IgM on immature B cells, helping them recognize invaders and begin the immune response. So I hope that makes clear about the trick and useful facts that you need to know about immunoglobulin. So now this is just a small slide to denote all the special function of every antibody. Like IgG, the G was for greatest, gestational, and also grab with phagocytes, which is opsonization, and also it's from Z gestational, so it is the only immunoglobulin which crosses the placenta or blood-brain barrier. And IgA, A was for areola of breast, so everything which we relate with 2, and it also provides a special function in mucosal immunity. IgM, M for men, so men are early response, acute infection, primarily produced. IgE, E as in there were 4 E's, among which the main was for allergy, parasites, helminths, histamine, eosinophils, so they have a vital role in parasite defense. And D as in mensap, D and balls, so IgD always come alongside IgM, and they are produced by naive B cells. And this is just a table to show the structure. Like I already said, IgM, while writing M we use the 5 points, so IgM is a pentamer. A as in 2, because areola of breast there are 2 in number, so dimer for IgA, and rest IgG, IgD and IgE are monomer. So I hope this makes everything that you need to know about immunoglobulin, and I made this video especially focusing the multiple choice question, so I hope now you can easily tackle the MCQs relating to immunoglobulin. So before I end the video, let's discuss about hypersensitivity. I said that I have a helpful mnemonic like acid or ABCD. So we know there are 4 hypersensitivity reactions, 1, 2, 3, 4. So acid here, A stands for anaphylactic or allergy, C stands for cytotoxic, I stands for immune complex, and D is for delayed, or it's mediated by T cell mediated, while type 1 is mediated by histamine. So that's a very helpful difference between type 1 and type 4, and type 4 is kind of delayed because it is only produced like 48 or 72 hours of reaction. Or other mnemonic like ABCD, A stands for same, anaphylactic or allergy, B is for antibody, C is for complex, which is the antibody antigen complex, and D is for delayed. So I hope now you won't be confused about what type of reactions are used in type 1, type 2, type 3 and type 4. And the very important table can be the differences or the examples of all the types of hypersensitivity reactions. So type 1, it's mediated by IgE. So how the mechanism works is that IgE binds to mast cells, they have the allergen cross-links, and histamine is released. As a result, vasoconstriction occurs. And the common example for type 1 I already discussed on my previous slide, saying that 4 A's are the most common example, in which they are anaphylaxis, asthma, allergic rhinitis and atopic dermatitis. And when it comes to allergy, so urticaria or hives also comes into play. So for type 1, always remember the 4 A's. Now coming to type 2, which is cytotoxic or antibody mediated. So this is mediated by IgG and IgM. So this can be very helpful because when we discussed about the video of immunoglobulin, I said that both IgG and IgM is responsible for producing type of anemia. And when we compared, we said that girls are more hotter than boys. So hot as in warm hemolytic anemia, and IgM for cold hemolytic anemia. So in type 2 reaction, the common example can be autoimmune hemolytic anemia, which is warm and cold. So again, let's go with the girls and M for men. So here usually the girls dominate it because the two helpful example can be the 2Z, the Goodpasture syndrome and Graves' disease, whereas for men M can be myasthenia gravis. And for dentistry, like usually from a dental point of view, it is important to know that pemphigus is considered a type 2 hypersensitivity reaction. Why? Because the main autoantibodies, like mainly the IgG, they target the desmoglin on keratinocytes, leading to cell destruction and blister formation. So since we know in pemphigus the main autoantibody that comes into play is IgG, and type 2 hypersensitivity reaction is mediated by IgG and IgM. So pemphigus vulgaris is an example of type 2 hypersensitivity reaction. So now coming to type 3, like in the mnemonic acid, I stood for immune complex. So for common example, you can memorize it as 3S, that is the SLE or systemic lupus erythematosus, other S for serum sickness, and the third S for post-streptococcal glomerulonephritis. So now other example that's very important is the Arthur's reaction. So how do we memorize this? For type 2, I usually said focus on the girls because there were two main Z, the good pasture syndrome and the Graves disease. So now comes the turn of boy, and you can remember Arthur's as Arthur. So Arthur is the name of a boy, right? So whenever you see Arthur or Arthur's reaction, it's mediated by type 3, not type 2, because in type 2 IgG was the main predominant factor for good pasture, Graves disease, and even for pemphigus. So in type 3 now is the role of men, and Arthur is the name of a boy, so Arthur's reaction is an example for type 3 hypersensitivity reaction. I hope now that clears your confusion. And finally, coming to type 4, like it is a delayed type and it's mediated by T cell. So for type 1 we remembered about the 4 A's. Now for type 4 we will remember 4T because it's a delayed type and it's mediated by T cell. So what are those 4 T's? First is the T cell, like it's mediated by T lymphocytes. The other T is for transplant rejection, so the chronic graft rejection falls in this category. And the other T, the tuberculosis test or the purified protein derivative test, or also called the Mantoux test, it also falls on type 4. And the other T is for touching or contact dermatitis like poison ivy, nickel and latex. So I hope this clears your doubt about type 4 hypersensitivity reaction. Just remember the 4T to make it easier. So usually in dentistry, type 4 hypersensitivity is very crucial to recognize as it underlies the delayed T cell mediated reaction to materials like amalgam, causing non-histamine driven white mucosal lesions that mimic other conditions, because type 1 hypersensitivity is mediated by histamine while type 4 is mediated by T cells. So whenever you see a white lesion which is persistent and located near a dental material, always consider type 4 hypersensitivity reaction in your differential as I have shown in this table, especially when there is no response to antihistamines and no systemic allergy symptoms. So the other common examples for dentistry related to type 4 hypersensitivity reaction can be allergic contact dermatitis or oral lichenoid contact reaction or allergic contact stomatitis and also perioral dermatitis. So this flowchart can be helpful, like whenever you see a white oral lesion which is persistent and located near dental material, then always consider type 4 hypersensitivity reaction, in which the common material can be dental amalgam, acrylic or resin materials, even latex or some flavoring agents that we see on toothpaste. So before I end the video, like for other slides, I have a summing up video which can be very helpful. So let's go through it. So first I use the mnemonic gamed as in gamer, in which G stands for greatest and the least, the E in list stood for least. So the highest is IgA and least is for IgE, and also for G, greatest, gestational, and grabbing the phagocytes. So like IgG has the highest serum concentration, it crosses the placenta, males are primarily produced, girls are secondarily produced, grabbing phagocytes. So opsonization is the main role of IgG. And when it comes to anemia, like girls are hot or warm, so IgG causes warm hemolytic anemia, and the G in gestational also shows that it plays a role in hemolytic disease of newborn or erythroblastosis fetalis, which is the role of IgG. Now coming to IgA, we said A as in areola of breast, so there are two breasts, so it's a dimer, and everything we related with two, like tears coming from two eyes, and the saliva mainly produced by the parotid gland, which are two in number, the left and right, and also the two areola or two breasts, and also they are found in mucosal surface. So all the secretory IgA, they provide the frontline mucosal immunity. Coming to IgM, M stood for main. We made M by making 5 points, so which says that IgM is a pentamer and males are primarily produced. And unlike IgG, which is girls are hot, so men are kind of cold, so they causes cold hemolytic anemia. Coming to IgE, there were 4 E's: the eosinophil, degranulation, allergy, parasite, and also histamine, and IgE is the lowest in serum concentration. They are involved in allergy, which mediates the type 1 hypersensitivity reaction, and the mechanism is that it triggers the mast cell degranulation, which comes to basophil and produces histamine, and as a result vasoconstriction is produced. And IgD, like D for differentiation, and the analogy which is a little vulgar, men have D and balls, in which the balls was for B cells. It is the least understood. It is present on naive B cell, and whenever IgD comes into play, IgM always helps IgD. So IgD and IgM are kind of related. And talking about hypersensitivity, like I give the mnemonic acid, and also like for type 1 there were 4 A's, and for type 4 there were 4 T's. And when it comes to dental focus, like pemphigus, it is type 2 hypersensitivity reaction because IgG autoantibodies comes into play against the desmoglin. And just for your knowledge, like there are two desmoglins, desmoglin 1 and desmoglin 3, in which desmoglin 1 is for skin and desmoglin 3 is for oral cavity, oral lesions. And type 4 hypersensitivity, it's a delayed T cell mediated reaction, and they play an important role in reaction to dental materials like amalgam, causing white mucosal lesions. So thanks everyone, that's it for today. I hope this makes your understanding of immunoglobulins and hypersensitivity reactions easier, especially from a multiple choice question point of view. So if you like this video, don't forget to hit the like and subscribe button. And if you want another topic for us to cover in a very easy way like this, then comment down in the comment section. Thank you everyone. See you in the next video.